Hi, you are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello and welcome to the ladies' room. You are going to love my next guest because I do, and I hope I'm going to convey that. We're talking with Shan Boodram, who is widely known as Shan Boody. I love that name. And we're going to ask her how she came up with that. Anyway, Shan is a certified sex educator, a dating expert, and a lifestyle personality. She is a YouTube star, which you probably know because you've been watching all her awesome videos on all things related to sex and relationships. She's also the host of Makeup or Breakup, a weekly Facebook live series based on my adolescence and young adulthood. She's also the host of the full screen series, Your Perfect Date, where she serves as a coach to help individuals in need of dating advice. Where were you 6 years ago? Anyway, she has been featured in numerous media outlets, including The View, MTV, Fox News, CNN, The New York Times, Forbes, and Time Magazine. But today, her career hits the big time because she is joining us in the ladies' room. Now, she's also an author of a book. You will love the title. It's called Laid. Yes, that kind of laid. Young People's Experiences to Sex in an Easy Access Culture, and is a contributor and writer for Freeform Network's The Bold Type series. Her work for the show also appears on Cosmo.com. Now, Shan lives in LA, but she's coming to us live from Toronto, where she's working on another project. But in her everyday life, Shan is a vocal advocate for sex-positive conversations and empowering the masses with clinical information through a lens that is youthful, knowledgeable, direct, and non-judgmental. And you know I'm about all of those things. Still working on youthful, but all the other ones I'm all about. Now, today we're going to talk about everything that we want to, but we're going to focus a little bit on a common vaginal infection called bacterial vaginosis, or BV. It is not an STD, but it is the most prevalent gynecologic infection in the United States, affecting 21 million women ages 14 to 49 per year. It will affect 1 in 3 women at some point in their lives, and many women will experience this repeatedly. Bacterial vaginosis, or BV, can affect women of any age, even if they have never had sex. And what's really unfair is it does not affect men because they don't have a vagina. So how do you know if you have BV? Well, common symptoms associated with BV include the very characteristic, unusual vaginal discharge that professionally we say it's white, grayish, or watery, but unprofessionally we say it has a very strong fish-like odor. Or Dr. Octavia Cannon and I discussed this a little bit in our episode on taboo topics in OBGYN. And she said one of her patients told her it smelled like cat pee. And she said,
wow.
I don't know what cat pee smells like, but I know that's bad. You don't know, though, if you have this infection just by the symptoms. So you do have to see your healthcare provider and get an exam. And then if you do have it, you will need prescription antibiotic therapy. If left untreated, some women, about 14 women, will get better. However, in most women, the symptoms not only generally persist, but there may be longer-term consequences. Now, while not an STD itself, having BV may increase the risk of transmission of pelvic inflammatory disease, as well as sexually transmitted infections, including all the big ones: chlamydia, trichomoniasis or trich, gonorrhea, herpes, and even HIV. In pregnant women, BV also increases the risk of preterm birth and low birth weight babies. So we do not want that. Now, let me tell you a little bit more about Shan. She's a spokesperson for the hashtag #KeepHerAwesome educational campaign to educate people about BV. This campaign is a collaboration between the American Sexual Health Association, or ASHA, and Symbionix, which is a Lupin Pharmaceuticals subsidiary. Without further ado, welcome Shan to the ladies' room.
That was incredible. I was learning. I was captivated. I learned about myself in that one. So thank you.
Well, it's on tape, so now you can play it as your meditation before you go to bed. I can make special ringtones for people.
I'm going to send it everywhere that I go. It's like, this is from now on how you're going to introduce me. I do not care if it's like at my nephew's birthday party or it's on The View. It's going to be like this. So.
You know, a friend of mine won a Pulitzer Prize many years ago, and he said the best thing about winning a Pulitzer Prize is you always know how people are going to introduce you for the rest of your life. And he said that's going to be in the headline of my obituary. So tell me, what do you want people to know about you? Tell me your life and your story that was not in the intro.
I think that's really it. I mean, for me, I've just always been really passionate about having taboo conversations in unlikely places. And I don't mean unlikely, you know, like in a private setting. I mean out there in the world. This is something that affects every single person. We're all sexual beings, whether or not we're choosing to be active or not. And I felt this was a massively underrepresented part of our lives. And in addition to that, what really drove me to get into this space is that, you know, sex sells and sex sells in the media, but sex ed tends to be boring, dry, monotonous. And so I saw a real hole for someone to come in and make this information accessible and exciting to people. And of course, conversational. So I think you and me are definitely driven by the exact same incentive, which is why we love this space and we'll stay in this space for a long time. And I love the Keep Her Awesome campaign because when it comes to taboo topics about sex, vaginal health, gynecological health is definitely a massive one. So when I thought they were making,
when I first started doing television in when you were probably still in diapers in the early 1990s, vagina was one of the words you were not allowed to say on television. When I started doing the Weekend Today show on NBC in like 1996, I had them specifically put it in my contract that I was allowed to say the word vagina on television.
Well, clitoris is even still like a thing now. It's not a given. So I don't even know if that's good because it's been how many years and we haven't advanced that far. So I think we have a lot of work when it comes to making sure that we feel comfortable talking about something that, again, impacts all of us. And like the stats will say, especially with BB in particular, it's not something that 1 out of every 3,000 people are experiencing. It's 1 in 3 women. So having these kinds of conversations out there in a public way, unashamed and factually, I think is incredibly important. And I wish there was a Keep Her Awesome available when I first got BV in my early 20s, because I definitely I'd never even heard the word before, actually.
So tell us about your experience. Like, how did you know you had it? What was the circumstances? How did you get it the first time? And what did your doctor tell you?
So I had a new sexual partner, whatever. I mean, there's a number of different reasons, whether it's not cleaning your sex toy properly or wearing clothes that are not quite dry. There's a number of reasons. It's an infection, mind you.
Wow. And these reasons, what you're calling reasons, are what we call risk factors. There's no real known cause per se.
Yes.
So I want to take away the blame. A lot of women try to feel like, and I know a lot of doctors present this way, like, what did you do that made you have this? Obviously, having a new sex partner is a risk factor, but that doesn't mean that is necessarily what caused it. That's like our best idea of what probably led to it.
At the time as well, too, I was like a track athlete, so I was wearing a lot of really tight clothes and
sweaty clothes
for long periods of time. So there's a number of different reasons, but for whatever reason, the reason why I was alerted to do something about it, I'm actually pretty grateful, because having a new sexual partner and then having the symptoms definitely said, go to the doctor. I think if I didn't have a new sexual partner, I would have just continued to get yeast infection treatments, which a lot of people mistakenly do, or I would have brushed it off as nothing. But because I had a direct catalyst, I was like, oh, something isn't right. And so I went to the doctor immediately, and that was the first time I'd ever heard the words bacterial vaginosis before in correlation with my diagnosis. And I was like, well, what is that? It sounds terrible.
It sounds horrible.
My eyes, what is this thing? And
BV sounds much less threatening.
It does. And I think as well, too, I mean, just why wasn't this talked about in school? Why wasn't I told about this? Why didn't my mother educate me about this and say, hey, this is a part of having a vulva. These are the things that may come up. You know, here's what you should be aware of.
Well, in fairness to your mom, when she was, I don't know how old she was, but let's just say when I was 20, we didn't even call it bacterial vaginosis. It had a totally different name.
What was
and
it
when I
called?
was in residency, it was called Gardnerella. So it was like a totally different thing. And I even remember when I was already a doctor and then this new name came up and I heard all this talk about bacterial vaginosis. I was like, whoa, where'd this come from? And my friend said to me, oh, no, that's Gardnerella. I was like, oh, that.
Oh, actually, I like that name better. But
pretty.
you know what? But bacterial vaginosis makes you want to take action against it, which I think is great. it's more inspiring, right, to do something.
And I
And so
love your story about saying sex ed is boring. I loved when my son was in 8th grade and they had the talk in health class. I was dying to ask him, afterwards, like what happened and how was it? And, but I was trying to be very delicate and ask just like an open-ended question. And he says, Mom, I know you're dying to know what happened. He said, basically, I can give you the whole summary in one sentence. In one sentence, the whole class was, don't do drugs, don't do sex, or else you'll die. And that was basically the whole gist of what they got out of that class.
But he knew that was BS.
Oh,
because
he had been living with me his, whole life. So he actually, they did a really interesting thing in this class. They gave them a pre-test before the class to get a sense of what kind of sex education they already had. And of course, as you would expect, my son was, like a superstar in terms of knowledge and actual information. So the way this quiz worked is there was a list of sexually related terms, and then the kids were supposed to check off whether the term was male related or female related. And he got a couple of the questions marked wrong, and he had a fit. So he went to talk to the teacher. One of the terms was testosterone, and he checked off male and female, which is correct. Even though men have a much higher level of testosterone, women still have some testosterone. And then the next thing he checked off, one of the terms was ejaculation. And he correctly checked off male and female. Now, not every woman ejaculates, but there have been some cases where it's actually been established that there are some women who have a small amount of ejaculate fluid. Anyway, so the teacher says to him, well, how do you know this? And he said, I saw my mother talking about it on The View.
That is an awesome story. I love it. I think it's so important. And it's actually, I was talking with a fellow sexual educator, and she has a kid who I think her son is like 12 years old. And she was like, I wish I had a daughter, because during this time now, we started to have the conversation with her about her period and her changing body and all the things I'm excited to talk about. And I have a son. What do I tell him? I'm like, the same information.
Exactly.
Be mutually exclusive.
Exactly. Because I think we've done a much better job educating our daughters about a whole range of not only sexual issues, but psychosexual and behavioral issues that are related to sex. But I don't think in general, we've done as good a job educating our sons. And I really made an effort with that. I also have a lot of siblings who are younger than me. And I'm about a little more than 10 years older than my sister. And so when she was a teenager, I was already, in residency to become a gynecologist. So I was giving her the talk, and we're in the car, and I figured, okay, I've got a captive audience and I'm addressing all these different things. And she was really quiet. And then she just goes, I hate having a gynecologist for a sister. I think a few years later she came to
she's like, she knows it. Every single question that she possibly has, every like discoloration and weird bump. I'm sure you're the first person that she called. I would love that. So
back to your BV story. So you went to your doctor, and your doctor got the diagnosis right away, and you were properly treated, or was there a misdiagnosis issue?
No, I was properly treated, and but the unfortunate part, not unfortunate, it's the actual normal part. 60% of women are going to see BV return within 1 year, and I'm a part of that stat. And so I got treatment, I saw my symptoms go away, and probably, it's been some time now, but a few months later, without any prompt, without this time any kind of really clear indication as to why, I just saw a return. And it actually ended up being a pretty tough part of my life for like a year or two. And when I was reading the study that Lupin did, and just talking really about how women's lives are affected, not only their sexual life, but their life in general, I connected with so much of that, because I used to have a desk job. And I remember feeling so paranoid about the smell that I'd be sitting there and being like, oh my God, people can smell me. I can smell myself through this. And it was like an obsession for like a year and a half, until I really finally started to become more aware about some of the triggers.
Did you have pain also, and burning and itching?
No, it was really just I only really recall the smell as being distinctly, I'd had yeast infections, of course, I'd had UTIs. And so I knew it was very different from those. And it was just the smell that really did take over my life and stop me from doing things that I love. And so they say that 17% of women, don't go on first dates if they have BV. Wow. And, 27% of women don't want to work out because they don't want to agitate the area and be in a public space. And I was like, I completely connect with that. And it's really sad to think that 1 in 3 women go through this, but we feel so alone while we're going through it ourselves, which is why.
And the statistics you're talking about are from a Harris poll that Asha did with funding from Lupin.
Yes.
And the statistic that I thought was really powerful, and of course, in the ladies' room, we're always talking about embarrassing subjects, but that over 60% of women said this was just profoundly embarrassing. And it hurts me as a doctor to think that women suffer because they're embarrassed. And, we sometimes use an expression with our girlfriends, we'll say, oh, I was embarrassed to death, but there are times when embarrassment, if it's preventing you from getting proper medical care, obviously it doesn't lead to death if you don't have your BV treated. However, it can lead to, very unacceptable consequences.
Right. As one of my friends actually who's HIV positive said that people are no longer, losing their life in the same way to HIV AIDS, but they are dying from shame and stigma because they're not getting tested. They're not going to get treated. They're not following up with their healthcare provider. They're not informing other partners. And it's a shame and stigma that we place around it that really is now the greatest threat to our sexual health. So it was something for me, like I said, when keeperawesome.com came along and they're like, okay, they're just going to have the information there, a very clear definition of the difference between yeast infection and bacterial vaginosis, which is such a confusing place, especially for young women who are new to learning about their gynecological health. All the stats information there, and then information on what to talk to your healthcare provider about. That's a big question too.
It's a very big question. I want to address this point about yeast infection. Well, I want to address a couple points about yeast infections, because of course, most women, by the time they hit 21, they have probably had their first yeast infection. But it wasn't too long ago that the treatment for yeast infections were not over-the-counter products. You had to get a prescription. And there were many doctors, including myself, who were not really enthusiastic about yeast infection medicines becoming over-the-counter products, because we felt that it's not really always possible for you to know the difference between a yeast infection or some other kind of infection. And the treatments are vastly different. So I know, and I've talked to lots of women who have treated themselves repeatedly with over-the-counter yeast infection products, when in fact, they really have bacterial vaginosis or something else. And the first time I had BV, I think I was probably around 30-ish. And I had already been married, and I was convinced my husband had given me some devastating disease. For me, the smell was not the worst problem, and that was not terrible, or maybe I didn't notice. But for me, it was the pain. It was like a burning, profoundly, like deeply itching pain, as opposed to a yeast infection, which is like moderately itchy. And it was that pain. And I was just like, you're not supposed to be thinking about your vulva, because we're using correct terms now. People, of course, always want to say your vagina, but you don't want to be thinking about your vulva and your vagina 24/7, especially for that reason. So let's go through, for women who have not experienced this, what the typical symptoms are. The number one most characteristic is what you said, that fishy odor. Certainly like a watery discharge, as opposed to a yeast infection, which is is usually described as a thick cottage cheese white kind of discharge. Although you can have a yeast infection and have no discharge, especially if your body forgot to read the textbook. And then many women can have this like burning, itching kind of pain. The good news is, if you go to your healthcare provider, there are many treatment options that are prescription options. However, the bad news is they're antibiotics. So what happens when women take antibiotics? That increases their risk for yeast infections. So lots of women will tell me, I was diagnosed and treated for bacterial vaginosis, but it turned out I had a yeast infection. It didn't turn out you had a yeast infection. It means you got a yeast infection after the treatment for bacterial vaginosis. So that's just kind of one of those nuancy things that we always have to be careful about. Did it come back, or is this something new? Which the line there is sometimes you have to go back to the doctor.
Which is, you know what, I don't look at it, I used to think about it in a negative way, but now I'm like, your relationship with your pH and with your vulva and your vaginal health in general is just a lifelong relationship. It's not always going to be on autopilot. And sometimes it is, sometimes it isn't. Sometimes you're going to your gynecologist more often. Sometimes you don't see them for years, and you're going to go through those ebbs and flows.
And hopefully you go once a year.
Right, at minimum. But there's definitely been a time, during that time, and to your point there, I spent so much time on forums at that time of my life, just reading other women's experiences who had the exact same thing, who had year-long issues and were continuously repeating, and people who had tried different things. And so I think having a one-stop shop that everyone can go to get the right information from it, we're not just trading horror stories, is massively important. But knowing that you're not alone, oh my goodness, that was such a big thing for me, because genuinely, and even just hearing you say it just now feels relieving to me. Just knowing that, like, okay, like we both were in this together. Because when you're going,
and I only had it once when I was in my early 30s, but once I turned 50 and I went through menopause, I started getting it more frequently, like maybe once a year. And I haven't really seen any research on this or any good answers about this, but I think it's because the vaginal mucosa also thins once you go through menopause. And obviously our microbiome and the vaginal flora change. And that's really the cause of bacterial vaginosis. So of course, we're discussing this all in all different order, but the cause is just that there are normal bacteria and normal yeast that normally live in the vagina. That's their happy home. They live in peace and harmony. And then there are certain factors that can upset the delicate balance of what we call the vaginal flora. Back to that whole garden thing, that whole Gardnerella thing. So yes, I'm a big fan of probiotics, which does not prevent this from happening, but it can help keep your vaginal flora in good shape or in good health. But the risk factors, let's talk about those. So we've already talked about new sexual partner. We already talked about working out and wearing sweaty, workout clothes afterwards.
Not wearing cotton underwear that allows you to breathe and keeps the.
Well, that would prevent it. But I'm saying working out, using your sweaty workout clothes would increase your risk. Lots of people have a myth or a misconception that swimming pools or public pools will increase your risk. That hasn't panned out. But being in touch, having your vagina or your vulva exposed to any kind of chemical exposures can. So if you're in a hot jacuzzi with really high chlorine levels, that can probably be a setup. Another setup is actually an IUD, this is one of the few downsides of an IUD. So on the IUD string, anal sex is a big risk factor. You talked about not cleaning sex toys properly, or using sex toys anally and then vaginally. And I can't think, what am I forgetting?
I mean, those are the main ones that I'm aware of. And I think that those all are triggers that I feel the average person, we just naturally interact with. And again, to your point that you can't play the blame game with this. You can't say this is why it happened, because there's just a number of different reasons. I almost look at it sometimes as being like your stomach. Sometimes you're just not going to react well to that hot dog, and other times that you do. And it's just the way that it goes. But if you have that relationship with it where you understand it, you have to check in sometimes, you have to go to the doctor, you have to find out what your new normal is. And again, as a woman's body changes, as it does so often, what worked for you during one period of time, something new happens and you're completely thrown out of whack. You got to find a new normal, a new balance for yourself, which is why having that relationship with your gynecologist is so important. So you can continue to check in and get the answers that you need and get treatment right away. Which is the most important thing when it comes to BV, is getting treated as soon as possible.
Yeah, I think a lot of women feel like, okay, if I just bite the bullet and grin and bear it, like tomorrow I'll wake up and this will go away. I've talked to lots of women who can't even sleep when they have this, because it's just so uncomfortable. And certainly they want to sleep alone. But back to what we were talking about earlier. How did you, so we talked about how you were always interested in being sexually aware and having sexually open conversations, but how did you become a sexologist? What was the education? What was the training? What was the preparation that went into that?
Yeah, so the first thing I did is I went to school in Canada for journalism, and then I wrote that book. And then after that, I went back to school to become a sex education counselor. And then I worked for a year at a university, really just helping students out, referring them to different doctors, giving them a sex-based information, working with new students and to find them, get their healthy kid going. And then probably in 2014, I went to a school in San Francisco. It was called the Institute. One second, I got a baby here. Hey, baby.
Oh, who's baby?
This is my niece, Zara.
Hi, Zara.
Hi.
How are you?
Good.
You're on TV.
Can you guys give me 20 minutes? Deal?
Awesome.
Okay.
I love that on your videos too, about how people just kind of come and go. And I love it when you have Jared on your videos.
Yes,
I love him.
This is like their exact version. They were in the window, like making faces at me. And just like, so this was them like tempting the water. So they pushed to the max end. I went to school in San Francisco and I got my associate in sex education. And then I did some hours there. And then I did my clinical sexology certification and then completed some hours there. And so 600 hours later, I was able to open up like a private practice and then just really just work more with professional boards, which has been a massively important thing for me because it's difficult to get the right information. Yeah. And so having a board of professionals I can go to bounce ideas off of, I think has just probably been my proudest moment, which is why, again, I love sites like Keep Her Awesome because it makes that same access available to the public. So the average person can go to for a reliable place of information because the internet can be a very wild place of homeopathy.
A wild frontier. I like to call it the too much information superhighway.
Right.
So all of the accurate information is there somewhere, but sometimes finding that information or accessing the correct information or interpreting the information in your own situation can be very difficult. And this is why I say that, the only person who can give you individualized personal medical information is your own healthcare provider. But the internet is great for background information and to help you formulate the questions that you need to ask. And so that's one of the things I try to do on my website is give women like the top questions to ask on a different subject, or if they have symptoms, and that can be very helpful.
Because that's even it too. It's not even a matter of where do you ask them, it's what do you ask, right? And then what answers, because there's going to be, if you put it out there, what is BV, you're going to get an echo back of a million different opinions and perspectives, and someone who believes it's from aliens and someone else we're supposed to be in the Handmaid's Tale time, that's why it's even happening at all. So I think that the more that we can guide people towards trusted, reliable sources that are backed with professional information that is sourced and tested with real people, real stories attached to it, that's what's missing. And I know for me, again, when I had BV and I was in that super gray, I guess pun intended, I was in that super gray space, I flocked online to try to find that community and didn't really find it. So I'm glad it's out there now.
That's awesome. That's awesome. So I know this launched recently. Is the site set up for women to ask questions, or they just have like the typical frequently asked questions on the site and people can get the information that way?
I think to your point, which is really bomb about it, and why we're like obsessed with the work that you do, it really does direct people more than anything else to go to their healthcare provider. So there is a frequently asked question section. There is, statistics to frame the conversation, and there is a guide to take to your healthcare provider to ask the right questions. But we're really trying to urge people, go to your healthcare provider. I mean, that's where you're really going to get the actual information that you need based on what your medical history is. And so we're trying to really arm people with that. Like, okay, here's the information. Here's what it is. Here's how prevalent it is. If it's happening to you, do not be ashamed or embarrassed, even though it's almost impossible not to feel that way. But you're not alone. And you're definitely not alone in trying to find help for yourself. And we're here to help you with the next step. But that next step is definitely not online. The next step is in an office.
Right. So, the next step is on the phone to make the appointment to go see your doctor. So yeah, I always say to patients that many times patients will say to me, oh, this is a really dumb question, or I'm really embarrassed. Or a lot of times people will apologize and they'll say, oh, I really don't enjoy this. And I will often say, if you enjoyed it, I would be referring you to a psychiatrist. Yes. This is not meant to be this is not meant to be enjoyable. This is, it is what it is. But I always say the only dumb question is the one that you were too embarrassed to ask.
I think you're the dream person that when you make that call and you feel that shame and you're not sure if you're in this alone, you're the person that I'm hoping picks up the phone.
Oh, thank you. You're the best. Well, you now have my phone number, so you can call me anytime. And we're not set up to have people call in and ask live questions, but we do take questions from viewers all the time. either on Twitter or Facebook or Instagram. And I even set up a private email address so people could send us questions at askdrdonica@gmail.com. So I hope that if we get questions that are meant for you, I can just shoot them over to you. We're going to have to wrap this up, and I could talk to you all day. I just, got this signal on my computer of what time it was. But before I let you go, one of the things that we ask all of our guests is, what is your most memorable, unique, interesting, or unusual experience that you ever had in a public ladies' room?
Oh my goodness.
Aside from this interview.
Right. I mean, this is definitely just awesome. My most memorable, unique experience in a public restroom. I mean, I just think it's all the moments bonding over menstruation, right? Like when someone is having like a crisis moment and they've overflowed and
they don't have a tampon and the machine is empty.
I was in a ladies' room once where someone had a spare pair of underwear.
Oh,
that they gave to someone else. So like in that
wow.
moment, desperately needed it.
That is sisterhood.
Yes. So like that's my favorite thing in there, I think, is just because we're all in this together. And again, there's still shame around our period, right? Like even this, I was thinking about today that, how I'm on my period right now. Okay. And I was packing pads for the plane, and I'm like, oh, I can't put it in the side pocket because it's a bit mesh. People may be able to see what it is. I'm like, why do I have to be embarrassed about carrying it? Even when we hand off a tampon to someone, it's like we're handing over like some missile codes. Like it's this really secret.
Right. It's really secret.
Contraband.
You have to go on my Instagram. There was a great picture that I put on there from Cameron Caskey, who is one of my personal heroes. He's one of the Parkland students who was at Marjorie Stoneman Douglas and witnessed this horrific massacre. And, one of the solutions that the grownups had for, trying to prevent gun violence in schools was that all the kids should have clear backpacks. And of course, lots of girls were horrified at this because we don't want everybody to see what we have in our backpacks. And it's, not ammunition, it's protection.
Right.
And so this boy, Cameron, got a clear backpack and he filled it up with Tampax and took a photo of it. And, of course, it went wild.
Yes.
It went viral. So I thought that was really a great way to illustrate the issue. But of course, almost every woman has a story about how she dropped her pocketbook on the boardroom table and everything fell out, including, tampons and pads. And, even though we try to be discreet. So I also heard another interesting thing about menstruation, and I'm not going to get the quote exactly right, but it's the only form of bleeding that is not from violence or disease. And yet it's the form of bleeding that we're most embarrassed to talk about.
Oh, wow.
And I thought that was so deep, and I thought, like, how did that happen? How did menstruation become stigmatized? But we'll save that question for our next topic.
I'm like riveted right now by that. I could talk about it, I think, all day long. And I'm one of those people who needs to get better at it. Like someone gifted me with this t-shirt that said, hi, I'm menstruating. And I want to wear that shirt, but I'm also like, I'm not really ready for it. So I got to honor my comfort level in my space, but really question myself, like, why am I ashamed to wear that?
No, there's a difference between being ashamed and choosing not to. There are lots of things that I wouldn't be ashamed to wear that I just choose not to wear because either the circumstances are not appropriate or it's not flattering or, it doesn't hide a multitude of sins. Or for whatever reason, or I don't like the fabric, or, and I'm kind of done with wearing t-shirts that advertise, anything or that have a message. So I think that was something I was really concerned with, in my 20s. That was kind of fun, but I'm kind of over that myself. But we will have you back if you are willing to come, and we will talk all about menstruation and stigma and what women need to know and what girls need to know, especially about their periods. And maybe what we'll do is debunk all of the myths and misinformation and misconceptions. And we'll get to, a lot of the issues about contraception and menstruation and fertility and menstruation. I mean, there's so many women who don't even know what days they're most likely to get pregnant, when they're having their period and where they are in their cycle and what.
Oh my God, there's a billion questions. I was actually just talking about the color of blood recently, how the color of your blood can be an indicator for you, something that is going on with you, but we're not even given that chart. So at the end of the day, I think the greatest thing we could possibly say is this is a conversation that has to be had, not just in the ladies' room, which this has been bomb and fun, but also maybe in the boardroom, or it could be in the classroom, or especially in the bedroom if you have a son or daughter. And I want to again encourage people to go to keepherawesome.com, and especially if you have a young woman in your life, direct her to that website. It might be that silent help that she didn't even know that she needed. And it's a non-invasive place to get information that can be life-changing. And I knew
Keep Her Awesome. And where can people find you?
I'm actually on keepherawesome.com. I got a little video on there and more information about me.
You have videos everywhere. I love your videos. I have lost sleep because I've been watching your videos.
Okay. Well, no, you look fantastic. So whatever you've been doing, listen, and I'm calling you back after this to ask all of my other secondary questions. My new gynecologist. I know it doesn't work that way, but I'm going to force myself.
Call me anytime. Absolutely anytime. It has been wonderful, wonderful talking with you, and I look forward to our next conversation.
All right. Bye, Doc.
Take care. Keep her awesome. That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Dunica. And please join us next week for another episode of In the Ladies' Room with Dr. Dunica. Real conversations with real women about really intimate topics.